Welcome. I'm Dr. Deuk here with Dr. Patel. We're going to be performing a left knee Deuk plasma rhizotomy. This patient has osteoarthritis of the knee on the left side. It's very painful for her. She's considering having a knee replacement. We've talked to her and told her that we believe this procedure, far safer and less invasive, may actually keep her from having to have a knee replacement. And the procedure is basically a rhizotomy. It's where we go in and destroy pain nerves to the joint that eliminates knee pain. This way, you don't have to have surgery, open surgery on the knee. You don't have to have a replacement of the knee. You don't have to go to the hospital. There's no bleeding, minimal to no bleeding. It's outpatient, and it takes about 20 minutes to do. So we're going to be performing the surgery on the left knee. You can see how large the knee is. A normal knee would be about a third of this size. It's big because it's full of arthritis, inflammation, scar tissue. All right, we're going to make our first incision. This is lateral. We're going to get started, and I'll have Dr. Patel assisting me. Are you ready, Dr. B?
Yes.
We're going to make a 4 millimeter incision in the skin. And then we're going to take our probe and go in, down to the bone. Shot. And we're going to basically destroy all the pain nerves sitting on the bone. Shot. If you have questions, feel free to ask me. Happy to answer them for you.
At this moment, no current questions.
So I'm going to have Monica, while we're giving our patient a little more medicine, have Monica show you on the x-ray the posterior, which is the back of the knee, using the little arrow. Can you see the x-ray there, Henry?
Yes, we can.
So the back of the knee is there, the front of the knee is there, and you can see our probe there. And we're going to be destroying branches, articular branches of the superior, lateral superior genicular nerve.
Yes.
Let me know when we can proceed, Dr. B. Have you given it to her yet or not yet? Now, I can actually feel the heat coming off her knee joint because remember, arthritis is an inflammatory disease. Lots of inflammation. Inflammation is blood flow to an area. That's why it's red, pink, red, because there's so much circulation going there. Normally the knee would not be this warm. Let me know when you're ready, Dr. B. All right. So let's get a shot. Nice. Shot. Probably a little more posterior, huh?
Yes.
I'm going to head more towards the joint as well, just getting to the edge of the joint. Shot. Shot. You think that's anterior enough or a little more anterior?
No, that's anterior. Go more close.
Shot. That's pretty posterior. I wouldn't go. Huh?
I go up to there and then come up and
I'm going to head more towards the joint. But you go up superior towards proximal, I mean?
little bit. Yeah. And then obviously.
Shot. Like there. So the problem is we can't see these pain nerve branches. We just know kind of where they run based on the anatomy, and that's what we're going after. All right. So that's one done. Now I'm going to move on to the medial. Keep some pressure there, Luis.
Do you want to come this way?
No, I can do it from here. I just put pressure, but give me the scalpel. We've already given some local. We're going to put a little pressure. The procedure doesn't take much bleeding. There's only a little bit of bleeding. And hold that. Let's just verify our entry point. That should be where we numbed up. Shot. That looks good. Let's make an incision. Dr. Patel, you agree?
Yes.
Any questions, Henry?
At this moment, no current questions.
So you're watching the future of orthopedic surgery right here at Deuk Spine and Deuk Joint Institute. The future of orthopedic surgery happening today, right here in our center. And this procedure, I predict, will replace all knee replacements, almost all. There may be a few that don't get this procedure because it won't work for some of the knee problems, but I think the vast majority it will work and keep people from having to have knee replacement. Shot? What do you think? I feel it wrapping around there. That looks pretty good, huh? So at this point, I'm going to move a little bit more towards the joint. Shot? And I apologize for let me move the Raytex a little bit. Move your hands. You can see better now. Shot? All right, you can see where we are. Once again, we're destroying the pain nerves through a wanding technique called the Deuk plasma rhizotomy. It was developed here at Deuk Spine Institute. It's patented. So, Shot? I think that's about it, right?
We have a question
Sure.
coming from Hassan on YouTube.
Hello, Assad.
Asking, thank you for the stream. I have a question. Is this the same as radio frequency ablation?
That's a great question. The answer is no, it's not the same. I need a pressure here, Luis. Okay, we need some clean Raytex. Radio frequency ablation, the doctor puts the needle in and leaves it in, and they don't move it. If you notice, we're moving. Hold this, Dr. Patel, on both sides. We are, with radio frequency, they put a needle where they think the nerve is, and they heat it up. They may take the needle out and reposition it, but with our technique, we're moving around and wanding. It's far more effective, and we're delivering more energy. So this is not radio frequency. Radio frequency, goal of radio frequency is to do what we're doing right now, but it can't do it because there's not enough energy delivered to the tissues, and because they're not wanding, they're not moving it around. We're the only ones who move it around, the wand around, while we're inside around the pain nerves, and that's why it's much more effective. Shot? All right, this is our last area that we're going to burn. Once again, shot, and this bovie is working, correct?
Yes, sir.
Because it doesn't feel like it.
You want to switch?
No. Shot. More anterior.
That's good.
Want to make sure. Which pain nerves do you think are most responsible for her pain?
I think infromedial, that's what our pain is mainly.
Infromedial.
What you doing right now?
This one. Any other questions? We're almost done. We're at the infromedial nerve right now. So the other two burns happened at the top. We're now at the bottom. Sean?
Yes, we have another
So I
question.
think I'm posterior enough, right?
Yes.
Here. And
We have another question coming
Sure.
from Hassan,
Sean?
once more on YouTube, asking, thank you, and why is the procedure name called plasma rhizotomy?
because we're generating plasma with this probe. Plasma is a high energy form of electrons, and that plasma is what destroys the tissue, the nerves that we're trying to destroy. You need plasma to be able to destroy those pain nerves. All right, I think we're done, right?
Yeah.
Patel, would you add anything else?
No, I think.
Let's hope that's it.
All right.
All done.
Thank you.
All right, thanks for joining us. You've watched a left knee Deuk plasma rhizotomy in a patient who is recommended for knee replacement. She's trying to avoid it. With this procedure, 4 millimeter incisions times 3, outpatient. She's going to go home in about, 15 minutes, 20 minutes from now. And avoid knee replacement. Avoid knee replacement. That's the goal.